Welcome to the Smile Spotlight. I'm your host, Tamara, and if you've been hiding your smile in photos, avoiding your favorite restaurants, or spending thousands on dental work that never seems to fix the problem, today's conversation is for you. Our guest is a leading expert in full mouth dental implants, and what he's about to share could genuinely change your life. Stay with us, and if you want to get ahead of the conversation, the number to call is on your screen right now. Today, we want to welcome Dr. Shawn Custer. Thank you for being here. And my first question is, tell me your background and how did you get into this full mouth reconstruction?
Absolutely. So I grew up in a small town in Nebraska. So Nebraska, born and raised. I did all my schooling in Lincoln, Nebraska. So we were there for about 10 years. And then I moved out to Colorado, where I found this propensity for surgical procedures. And then I started teaching with the Colorado Surgical Institute.
Wow.
Pretty much from its inception. So I was on the ground floor of teaching in that learning environment and getting to see a lot of these implant procedures and really being a part of a lot of full mouth reconstructions.
Wow. So, how long ago was that?
It's about 10 years ago now.
Wow. So 10 years of just doing this.
Yes, absolutely.
It's a great history.
And a lot of lives seen changed.
How many teeth do you think you've replaced over the years? How many full sets?
Oh my gosh. I don't know if I could even count now. I would say it's definitely in the hundreds.
Wow. Hundreds of lives changed.
Hundreds of lives changed.
And smiles made.
And smiles made, for sure.
So what drew you to full mouth dentistry replacement and reconstruction?
Well, I graduated from dental school and I kind of didn't quite know my direction. And so after graduating, I really had a propensity for surgery. It just really fell into my lap and I was really comfortable with it. And so I started taking CE or continuing education and found that I really loved surgery and the things that I was doing to help people with their smiles and their lives just really attracted me to that part of the field.
Well, it changes lives.
It does. It does.
Really amazing what a smile can do.
It's communication. That's the heart of how you interact with people. So.
Well, so how many full arches have you completed?
More than 100 now, and.
So 100 lives changed.
100 lives changed, yes.
Incredible.
Yeah, it is. It's the most incredible feeling when that patient gets their new teeth and I get to see how it impacts their lives because that story never ends. It's not something that goes away. Most of these patients become family.
Oh, wow. One of the things that I'm wondering about is what is a typical patient that comes through the door? What is the starting point for them?
The starting point's a little rough. Most people are pretty embarrassed and uncomfortable, and they've been hiding their smile for years and years, and they haven't even shown their family. Most families don't even understand where they are, and so by the time they come in to see us, they don't want some strange doctor, picking apart the things that have gone poorly in their mouth, and so. We really try to get people in the door in a comfortable way, in a low stress, nice, easy way, because otherwise it's so hard to make that first step.
Oh, absolutely. I mean, I would imagine that there's a lot of fear involved as well, like embarrassment and fear. Embarrassment
and fear, definitely, and just this overwhelming sense of shame.
Mm-hmm. That's tough.
Yeah, it's really hard to deal with that.
Well, so for somebody that's never heard the term, what exactly is an All-X?
So an All-on-X is a dental implant procedure. The old coined term, the brand name term was All-on-4. So we would place 4 dental implants and we would give a whole new a bridge of teeth to go on top of that. And now with the new advents and the advances in dental implants, we've found that 6 implants is kind of our ideal, 4 to 6 implants. So we say All-on-X because it's an arbitrary number.
Okay, and so what is the difference in dentures and an All-X?
So dentures are a plate that goes in the mouth and it relies on the suction of being able to attach to the tissue, which there is none. So most people are using glue and things to keep the denture in. The denture has no permanent reinforcement. It's just there and you're taking it out at night and it's not doing much to improve your chewing.
I remember my grandpa had dentures and I remember him chewing
yeah, sure.
and he complained about it hurting and rubbing and it was just an always issue.
I always tell people it typically becomes a pocket ornament. You know, you wear it when you're taking photos or you're at family dinner, all those times that it's like more intimate and you're conversing with people. And then when it comes to actually chewing food and utilizing them, it's pretty difficult for patients.
Yes. And so how does the All-on-X change that for a patient?
Well, we get structure back. We get a foundation back. We get something to hold that in place, and it's permanent, so you don't have to take them out. These implants are going into really solid bone in different parts of the face to give you the retention and the ability to chew at 100% of what you had when you had your natural teeth.
Wow. So like with the dentist, like there were only certain foods my grandpa could eat, right?
Yeah,
like he couldn't just eat anything. And he was very cautious about that. So with the All-on-X, you can just, it's like having your regular teeth.
Yes, it's completely changed the way that people are able to eat because they can actually eat those foods that are, you know, you have to bite portions off or that are really tough. So I always say it's the favorites. It's the corn on the cob, it's the steak, it's the apples, it's the stuff that, you know, is honestly really healthy for you and difficult to eat if you don't have that foundation and that structure.
Wow. That would have been a game changer for my grandpa.
Right.
Wow. Amazing where we've come. Well, so now, can patients come in and how long does this take? Like, do they come in and it's like weeks of back and forth, or is this a 1 or 2 day thing?
We try to make it as quick as possible because a lot of these patients that are coming in have a lot of dental fears. I mean, that's started the whole journey of not having the teeth that they want anyways. So first appointment, the patient comes in and we sit down and we meet and greet. I always want people to get to know me a little bit before we start this process because this isn't like getting a filling or a crown. You know, you're coming in to get something that's going to change your life, and you need to make sure you're with the right person to do that.
100%.
So first appointment, they come in, we do a little bit of meet and greet, and then at that appointment, we're taking x-rays to confirm that you're a candidate.
Okay.
That first appointment basically gives us all the information that we need for surgery day. So then the patient can get scheduled for surgery.
Wow.
Surgery happens one day, and then typically either later that day or the day after, we're delivering like a temporary set of teeth.
Wow. And a temporary set of teeth, is that a denture, or is that more part of the implant situation?
No, so it's attached to the All-on-X. There's no denture involved. The teeth are being screwed in the next day, and they are permanent to the fact that you're able to chew. You're on a soft food diet, but you are able to chew with them and you're able to smile with them.
So you get a new smile in 2 days?
In 2 days, yep.
That's pretty incredible.
It's life-changing, and it cuts down the difficulties of getting through the door.
Okay, so another question I'd have is like, are you just coming here to the office, or do you have to go to the hospital, and what does that look like?
So all of this is done in the office. We have all new technology, and everything that we've been able to convert this to a digital process has allowed us to do it in-house. Everything is here.
Wow, so one-stop shop right here. You can walk through the door, visit with you, get to know you, schedule your appointment, and then in 2 visits, you have changed your smile in your life.
You've changed everything about your life.
Wow, that's really special. That's something incredible that you guys are doing here.
Thank you.
Congratulations.
Yeah, we're excited about it.
100 lives
That's why we
changed.
want people to see, yeah.
And many more to come.
Absolutely.
That's going to wrap up this segment, but stay with us. We're going to be back with Dr. Shawn talking about trust and reassurance.
Hi, I'm Dr. Bill Keith. Welcome to Keith Associates Dentistry, your trusted family dentist. We've been a part of the Kansas City community for over 40 years. Located conveniently at Shawnee Mission Parkway in Knoll, we are experts in providing all aspects of dentistry, and we're eager to welcome you to our practice. With a state-of-the-art surgery center, an in-house dental lab, and a vast array of services and treatments, Keith Associates has everything you need to address all your dental health needs in one place.
If you're just tuning in, I'm Tamara Day, and today I'm sitting down with a doctor who's helping people get a brand new permanent smile, often in just 1 day. We've been talking about who this is for and how it works. Now I want to hear about the experience, the technology behind it, what patients actually go through, and why so many people say it was easier than they ever expected. And if anything you hear today sounds like it could be for you or someone you love, the number to call is right here on your screen. Dr. Shawn, I'm really interested in the technology behind this. When a patient comes in, how do you plan for the technology behind the procedure?
So everything in this world has become digital, and finally, dentistry has followed suit. And so now we get to bring this into the digital world, and that's shortened the appointment time. It's shortened the amount of workload that we have to put on the patient to get this started.
Wow.
So all of our records are taken typically in about 10 to 15 minutes in the first appointment.
Really?
Everything we need. Mm-hmm.
That's incredible. So is it the same old days of like all the big things that have to get put in your mouth to get the x-rays, all of that kind of stuff, or is it different than that now?
The digital dentistry has totally done away with the goop and the difficulties and all of that, yes. It's made it so much easier for patients because we don't have to go through all these multiple appointments, and we get to do things right up front.
Wow, that's incredible. Why does the experience you have matter so much in this process?
Because getting in the door is so difficult in the first place. We want to make sure that these patients are able to get themselves in the door, but then also we don't want to bog them down with all this difficult record gathering and information gathering and different things that really put a roadblock in this process for people. We want it to be fast and efficient and easy because it's not been easy to date with their dental journey.
Just super streamlined.
Yes, absolutely.
Start to finish. A lot of people have been told that they can't get implants because of bone loss and different issues. Is that still true?
It can be true, but it's generally not true.
Wow.
Most people have been told that by one dentist or another, and I think a lot of it has to do with the training and the available, skill sets that doctors have. This is something that requires a lot of additional training to get used to. Now, using angled implants and implants in other places of the bone, we've been able to pretty much get any patient in teeth. Can
you tell me, what do you mean by angled implant?
So an angled implant is just a way to use bone that's available. It's just getting smart with where we're placing implants. There's nothing complex about it. It's just knowing the anatomy of the human body and being able to work with it and make it possible.
Wow. Okay, so what about somebody that's been wearing dentures for years? Is that a candidate?
That's my favorite patient.
Really?
Yes, absolutely.
Tell me why.
Because I can change their life instantly. They've been wearing dentures, they already know the difficulties of wearing dentures, and they're ready for a change because they're so sick of everything that comes along with wearing dentures.
Wow, okay, great. So what about a medical condition? I've heard like diabetic may not be able to do this. Is that the case?
I think we put a lot of value on keeping our patients as safe as possible because at the end of the day, this is just teeth and we don't want to put you in a dangerous place, but most medical conditions can be worked around.
Wow, that's incredible. Okay, let's talk about something I'm wondering, everybody's wondering, how much pain is involved?
Everyone asks that question. That's the best question. I love that question because it's difficult, right? This is still a surgery, but most patients are telling me by the next day or 2 days later that they're feeling pretty good. They're still recovering, right? It's a surgery, but they're feeling well enough to get back to life and they're doing most of their daily activities. And I would say that's a pretty great recovery for new teeth.
Well, for a new lifestyle.
Yes. Yeah.
A couple of days, totally worth it. Okay, tell me, what options do patients have if they're really nervous? Like, can they be asleep for this? Is this something that they have to be awake for?
It is absolutely something that they could be awake for.
Okay.
I would say a majority of our patients are being IV sedated. So we're doing sedation with medicine through an IV line, and they're asleep through the process. Again, it's something that you could do while awake, but it's also something, it's been hard enough to get in the door already, and we just want to make it as easy as possible for you.
And as comfortable as possible.
Yeah.
Right?
Yes, absolutely.
So what does the recovery look like?
So patients are typically day of surgery, teeth are extracted if there are teeth, or removed. Teeth are removed, and we're placing implants at the same time. Okay. Everything is closed up. Patients will either be sitting in the chair until we get teeth made, or they're gonna go home and get a good night's sleep and kind of recover from surgery day, and then the next morning we'll deliver teeth.
Okay, you just said get teeth made. Are you making the teeth here?
Yes. That's one of the best advents of the digital dentistry.
That's incredible. So they're in having surgery, and then in the other room, somebody is making the teeth that you're going to implant.
What's happening is all the records are being digitalized. So they're put up into the computer system, and somebody is designing teeth on the computer system. And then we're actually 3D printing those teeth.
Wow, we're living in the future.
It is an amazing future, isn't it?
That's incredible. Okay, what do patients worry about most that ends up being not a big deal?
I think the main thing people are worried about is the recovery. They're wondering what it takes to get through this process.
Right, but it sounds like only a couple of days, and they're back to living life, going back to work, and feeling great.
Yes, patients are on a soft food diet during that period of time. It's really important for us. The implants go in with a certain amount of, stability the day of surgery. It's kind of like, I always think of putting fence posts in concrete. I know that seems kind of barbaric, but that's what
that makes sense, right?
Yes. So we're putting the implants in, and that concrete has to set up. It has to actually fuse to the post and create its stability, and that takes about 3 to 4 months.
Okay, but I would guess that people that are coming in here for a full replacement are already on a soft diet. They're already very tentative about what they're eating and doing. So is there much change from daily life to this?
There's really not much change at all. Yes, You're exactly right.
That's incredible. I mean, it feels like this is so streamlined, so technology advanced. It's just really incredible. And that you can walk in and out with a new smile in one day.
Yes, I would love
2
to
days.
take the credit for that, but
incredible.
Honestly, the technology has made this so much easier.
Wow, so impressive. That'll wrap this segment up, and we'll be talking with Dr. Shawn about smile transformation and value.
Hi, I'm Dr. Bill Keith. Welcome to Keith Associates Dentistry, your trusted family dentist. While we offer a full scope of general and cosmetic dentistry, we also have a focus in dental implants, wisdom teeth removal, and Invisalign, as well as dental veneers. We use the latest technology and practices to give you the smile that you always wanted. If you're looking for a new dental home or just want a second opinion, we invite you to give us a call or visit our website, missiondentist.com.
If you're just joining us, I'm Tamara Day, and I'm here with Dr. Shawn. And we've been talking about a procedure that replaces a full mouth of failing or missing teeth with a brand new permanent smile. We've covered how it works and what the experience is really like. Now let's tackle the question I know is on a lot of people's minds. What does something like this cost? And how do people afford it? Before we get into that, I want to remind you, if this sounds like it could be an answer you've been looking for, you can call the number on your screen right now to schedule a free consultation. No commitment and no pressure. Dr. Shawn, how should patients think about the cost of this?
That's one of the most important decisions for people, because you have to figure out how this is going to fit into your life.
Right.
But I also like to tell people most of our patients are financing this procedure. We try to make it very available and very possible for them to get this done if this is what they deem very important in their life.
Well, and how does it compare to previous dental work that they've already been having, like price-wise?
So it's the thought process of we're replacing all of the teeth.
Right.
So if you imagine if you've had work on a single tooth and the cost of that, if we were to go and replace every tooth in the mouth individually, I mean, that's a $100,000 procedure.
Easily.
If not more, yeah. The way that we're doing it with 4 to 6 implants, we're able to cut that cost considerably down and still get you the same function and the same type of teeth.
And it seems like even better than what they had before.
Typically, it's considerably better because it's actually solid. It has some foundation to it, and it lasts.
Wow, that's incredible. Okay, but speaking about how long it lasts, like how long does this last? Is this a lifetime solution?
For most of our patients, this is a lifetime solution. I always say, now you've got to take care of it, of course.
Right.
But you wouldn't make this life-changing or have this life-changing procedure if you weren't going to take care of it, if it wasn't going to change your life. This is your new baby. So.
Right. Can you share a story about a patient that you've recently worked with?
Yes, absolutely. So we had this patient come in, and actually she was kind of pulled in by her daughter. It was amazing. It was wonderful to see how much the family wanted this for her. And so she was really nervous and very scared and very embarrassed, but the daughter kind of pulled her in the door. And,
sweet of the daughter.
Yeah, it was amazing to see. And so we did our initial consult, and she was still kind of not sure. She was very nervous and apprehensive, and the daughter actually said, "No, you're getting this done." And it was wonderful to see that, because this is something that changes the whole family. If you imagine somebody—
family pictures.
Yes, family pictures.
Right?
I always think of Sunday meals with the family, right? Like this is everything that your family wants from you. They want you to communicate and be involved in their life.
Well, they want to see you smile.
They want to see you smile.
Not hiding your smile.
Absolutely.
That's amazing. Okay, so if you had a family member who needed this, what would you tell them to do? What would be the next steps?
Well, first of all, I think it would be really important to figure out what's best for you. If this is actually what you need, make sure that we're in the right place and that you've got everything that qualifies you as a good patient for All-on-X.
Right.
But the next step would be making a phone call, for sure.
Okay, well, and the number is on the screen at any point. Anybody can call in and find out what they need to know for themselves. But what's the myths around this? Like all the different theories and things out there that might be scary for a patient. What would you say those myths are, and how would you talk a patient through that?
Well, I know we've already talked a little bit about pain and the difficulties of recovery, but I think another myth would be that, I'm not a candidate. Mm-hmm. Most people are really concerned that they've heard no all their life with their teeth. Something's wrong. They've had the tooth has just crumbled and disintegrated on them, and the dentist has said, "No, I'm sorry, you need to get that tooth extracted." Mm. And so they come in with a lot of apprehension, thinking that this is just not going to be something that's going to work for them.
Right. When a patient is thinking about this, when somebody's watching this and thinking about doing this, what should their next step be?
Next step should definitely be to find a doctor, mm-hmm. Get evaluated, and then maybe bring a family member with them.
Okay.
Somebody to be supportive through the process, because I think this is not just an individual decision typically in people's lives.
Right. And the easiest way to find that doctor is pick up the phone, make a phone call here to Keith Associates. And what happens on that phone call? Is there a lot of pressure, or is this something that it's just informative?
Well, since we do a lot of this here, our front desk is really well trained in talking to people about this procedure. Mm-hmm. We want to make sure that you're able to gather some information without having to take any big leaps and steps. We would love for you to come and see us. Of course, we want to meet you. But we also want you to have the information that you need to make sure that you're making the right decision.
Right. Well, and I imagine even just picking up the phone can feel scary, but knowing that somebody on the other line is caring, has been through this and walked through this with hundreds of patients,
yes.
and understands the struggle that you're going through to make a big decision like this is huge.
Yes, you're not unique, right?
Mm-hmm. That's wonderful.
This story gets heard a lot in our office, and that's why we pride ourselves on doing it.
That's a beautiful thing. So when somebody's thinking about making an investment like this, what are the options of paying for this, and how much does something like this cost?
You know, I'm trying to remind patients that most people that are getting this procedure are using some form of financing.
Okay.
And so we really try to make a lot of options available. And it's very similar to somebody wanting to buy a car or something like that in their life. And so this is not typically something somebody is paying cash for.
Is it something they have to go find the financing, or is that something they can do in-house with you guys?
We have multiple financing options here, and we try to make that very accessible for people, because it's another added step to have to go outside of our practice and try and find the money to do this.
Right. So easy, all in-house. You come in, you get the consultation, you figure out what is available to you and what kind of a candidate you are.
Yes.
Right? And you have all the financing options available. And this is a life-changing procedure. This is not a quick fix and you're going to be back in 5 years. This is for life. And so You're making an investment not only in your smile, but in the rest of your life, which is
absolutely
fantastic. And all in one place makes it so simple. So One of the things I'm curious about, so you come in for your first appointment and you have your consultation, you schedule the first surgery, and same day or next day, you walk out with a new smile. But there is a recovery time that is soft foods. What happens next?
So the final step really of this process is to get your final teeth. So the temporary teeth, I call them your smile teeth. These are the teeth that you're on a soft food diet and you're being as gentle as you can with, but they're a full smile tooth or set of teeth. The final teeth are made out of zirconia. So zirconia is a beautiful ceramic. It looks very natural. It looks like the teeth it looks better than the teeth you probably had earlier in your life. Wow. So the zirconia gets milled in office. So again, everything is done here. At the final 2 appointments, we have you in and we get you in the chair and we take final impressions for the zirconia teeth. In that appointment, we're not numbing patients. You're not asleep. It's not a surgical procedure. It's a very quick procedure. Wow. Once we get the records that we need, we're able to make your next set of teeth, and then all we have to do is screw those into place.
Wow, that's incredible. So tell me, when somebody walks out with their forever smile, are they? Do they look all shiny and bright and like a movie star smile, or do they look natural, like this was the smile I was born with? We
use a lot of special records to make sure that we're giving the laboratory as much information as possible, and that allows us to make a very natural smile. Of course, we can give you a Hollywood smile if you want it, but we like when our patients have a very natural smile, and that way, when they're with their families and they're communicating with people, it's not an eyesore. We want it to be something that fits into their profile very well.
Oh, I love that. Tell me, when someone is considering this, what would you say directly to them? Like, what is that message that you would want them to know?
So I would probably say that I just would love a chance to meet you and talk to you about the options that you have. Nothing more than that.
Dr. Shawn, thank you so much for all this information. If I had a family member, I would feel so safe and secure bringing them to you to talk through what this might be.
Well, thank you as well. It's such an opportunity for me to come and talk to people about this procedure. I think it's really life-changing for people.
It's a beautiful thing you're doing.
Yeah.
You heard it from Dr. Shawn. The first step is just a conversation. No judgment, no pressure. If you or someone you love has been living with dental pain, loose dentures, or a smile they're hiding from the world, this could be the moment that changes everything. Call the number on your screen right now to schedule your free consultation. Availability is limited, so don't wait. 6 months from now, you could be smiling in every photo, eating whatever you want, and living the life you deserve. All it takes is one phone call.